Thank you. Thank you so much for having me. I've been very excited to do this webinar for Evidence Synthesis Ireland. So I'm just going to get straight into it. I love scoping reviews. I am incredibly passionate about their methodology. And I even loved it so much that I made a cake that said scoping reviews are awesome last year, and I've got to make it again. As much as I love scoping reviews, I do get frustrated sometimes because I think we often don't understand what we need to do with them, or the methodology that their approach and the scope that they do have. So I'm very passionate about educating about scoping reviews, and if you ever email me, I'll try to get back to you with a response. So hopefully this can clarify, I think, some of the trickier sections that we find in scoping reviews, which is exactly how do we extract, how do we analyze, and then how do we present the data. So hopefully I can break this down a little bit further for everyone today. Please ask lots of questions. I'll try to go through as quickly but as informatively as possible, to ensure that I can be able to get to those questions at the end. So I suppose the question is, what are scoping reviews? For us, this is a definition that was made by the JBI Scoping Review Methodology group last year. And what we believe it is a type of evidence synthesis that systematically identifies and maps the breadth of evidence available on a particular topic or issue, often irrespective of the source. So we'll see scoping reviews including primary research, reviews themselves, reviews of reviews, or even non-empirical or evidence, and a lot of grey literature as well. So this is within or across any particular context. Scoping reviews can clarify key concepts or definitions in the literature and identify those key characteristics or factors that are related to a concept, including those related to methodological research. So for me, for a lot of reasons why I would do a scoping review is to understand, I suppose, a lot of the background information that really, I suppose, makes research drive. As a methodologist, that's what I'm interested in. So other reasons why we would do a scoping review would be to identify the types of available evidence in a given field. What is out there? We need to sometimes know that. Is there many systematic reviews that have already been conducted? Or, is there no reviews? Is it only primary qualitative research? Is there no research out there? That can be really important questions to answer. We need to clarify key concepts or even definitions within the literature. What I interpret as a concept might be different to other authors' interpretation, and that has challenges for when we further synthesize the data in a systematic review. So having clarifying key concepts or definitions can be extremely helpful, and a scoping review is a perfect example of how to do that. You can how research is conducted on a certain topic or field. So how is the research being conducted? What is being done? Is it only observational studies? Is it RCTs? How are those being done? Maybe the key factors related to, or of characteristics or factors related to a concept. What does it mean for someone to be, to have or the concept of stigma? What are those characteristics associated with that? It could be a precursor to a systematic review. You can say, I want to do a systematic review. However, I don't know what outcomes are out there. I don't know how they're being measured to make sure that I can bring these outcomes together in a meta-analysis. So I'm not sure if it's really worth doing a systematic review. It might be better for me to do a scoping review to understand the available literature and to know how that literature is being conducted. But it could also be utilized to identify and analyze knowledge gaps. So I just want to highlight, I have QR codes of any papers that we have done. So you can put your phone to the screen and that should hopefully take you to that paper so you can read it later as well. So often we have this question about, like, what review should we do? And I just wanted to highlight this tool. It's called the Right Review tool. And it can help you answer a series of questions and help determine if you need to do a systematic review or if a scoping review is more appropriate, or any other type of review that's out there. So that's a very useful tool if you're trying to determine what review should I actually do. So that's a very online tool, and you can show to your students or yourselves, anyone that you know. I find people love it. But if you just wanted to answer just a few questions to yourself about what would be if you are needing to do a scoping review. And this is often our issue, is people say they need to do a scoping review, but we sit with them and it's actually a systematic review that they need to do. And as I am an advocate of scoping reviews, I'm an advocate of well-conducted and needed scoping reviews, not when scoping reviews aren't needed. So for me, I always ask the question, do you want to use the results of your review to answer a clinically meaningful question, or provide evidence to inform practice? Are you interested in the feasibility, the appropriateness, the meaningfulness, or the effectiveness of a certain treatment or practice? So these are your potential experiences questions as well. Then, because those questions can potentially change clinical practice and requires us understanding the quality of the evidence and the certainty of the evidence, that is a systematic review approach. However, if you are just interested in, not just, but if you are interested in the identification of certain characteristics, concepts in papers or studies, and in the mapping, the reporting, or the discussion of these characteristics or concepts, then a scoping review would probably be your right choice. So always ask yourself these questions prior to undertaking any review. And sometimes what I have is systematic review. Can we change this question to a systematic review question? So always think and reflect on what the work you actually want to do, who you want to target this work for, and what do you want it to achieve. In saying that, we have what we are now calling the big picture review family. And this is a recent infographic that I helped develop. So we're not only seeing scoping reviews, but we're seeing mapping reviews and evidence and gap maps. And that is a whole webinar in itself about the differences between these types of reviews. So if you are also thinking of a scoping review, also go, is it a mapping? Is it an evidence and gap map, or is it a scoping review? So sit with yourselves and ask those questions about what is going to be the most appropriate choice, because that's going to set you up to be able to perform a better quality evidence review that you can do. Okay, now that I feel like I've talked about why you should or shouldn't do a scoping review and set that, we're going to go into the guidance that I kind of follow, and that is the JBI guidance. So we have a 9-step guidance, and the first 3 steps are really developing your protocol. We believe your protocol is your recipe card for success, and really, again, helps you sit, reflect, refine what exactly you are going to do. So you're not making those decisions in the spur of the moment, and then you're not even forgetting those decisions. It's all transparent and it's a rigorous approach, because a scoping review is just as rigorous as a systematic review. It's just answering different types of questions, therefore has slightly different processes, but it's still rigorous, it's still transparent. And I think people have this idea that scoping reviews take less time. And that is completely untrue. Scoping reviews can take years, just as systematic reviews can. So just like a systematic review, after you finish your protocol, you start your search, which will be across multiple databases. You may even include grey literature. Because your question for a scoping review is going to be much broader, we use the PCC, you're often going to be screening a lot more. And so that takes time. Well, once you actually got all your included evidence, you then have to extract this data, analyze it, and present it. And that's kind of where it differs with a systematic review. So I'm going to break this down a little bit more as well. So before I do that, I want to highlight one of the key differences for, between scoping reviews and systematic reviews, and that is the use of critical appraisal or risk of bias tools. Do we do that in scoping reviews? And as the cat says, no. And that is because, again, the findings that we are collating and analysing are not going to be used for evidence for clinical practice change. And so we don't really need to be able to do critical appraisal and risk of bias. It's not going to tell us much. Plus, the information that we have, it got so many different sources involved in a scoping review that answer is probably not going to give us any answer that we need to do. Now, that's not saying that we haven't seen scoping reviews where they just said we want to see what is the available evidence out there, and we want to see the quality of the available evidence. We're not going to use those findings to change clinical practice change. But for the majority of scoping reviews, there is absolutely no need to do any form of critical appraisal. So just in case you want to read the article about how to extract, analyse and present the results in scoping reviews, I've left the details there. So feel free to QR code this. But this is a paper that we wrote, and I actually had this idea because I did a scoping review in my PhD candidature. It was aptly named Lucifer by the end of it, because I was so frustrated with the process because I didn't feel like there was enough guidance. And I kept asking why, how do I actually do that? What do I actually need to do? I was so confused about the process. And so we, having joined the JBI Scoping Review group, I thought this would be a good guidance to really put some detail into it. So we see that this is a very challenging area for scoping review authors. We see scoping review authors, I think, overreaching in the analysis stage. And unfortunately, a lot of this time when an analysis is undertaken further than what a scoping review requires, it really meant that it needed to be a systematic review. And so we're hoping that this helps clarify that as well, and reduces any inconsistencies or inappropriateness that we can find as well. So when we do any form of scoping reviews, and especially during this extraction, analysis and presentations stage, you need to be having open and constant communication with your team. You need to ensure that you are on the right understanding, that you've got clarity in your approach, because that is going to make for a lot easier process. I also wrote this section because this is a section I strongly struggle with scoping reviews. Often we have quite a lot of data. We're not looking at reviews that only have 6 articles included. A current scoping review that I'm looking at, that I've just finished extracting, I still have to check it, has over 400 articles. And that's only one of them, and I do have another scoping review that I'm working with that also has over 400 articles as well. So you can see just how time intensive that this extraction stage is. So it's very common to go through these phases when it comes to extracting data. Firstly, you have this, I'm getting very excited because I'm no longer having to screen, because often you're screening quite a lot. So you get so excited. You then face the reality of the situation of how much you have to extract. So you know you have to do it, but you don't know if you have the strength to it. At one stage, you just feel like you are drowning in extractions. And then you get to this point, though, this stubbornness in yourself where you go, I am too far, too gone, so I will not yield. Then you get excited again once you finish. So I'm in the I'm just so excited, I just can't hide it stage in one of my reviews. But in another one, I don't know what I have to do. I know what I have to do, but I don't want to do it stage. So I just want to tell you that this is, as a seasoned evidence synthesizer and scoping reviewer, these feelings are all normal. We all have different coping skills when it comes to extraction, and having a good team very definitely makes it better to get you through any form of extraction marathon, because it definitely is a marathon. There is no sprinting in extractions. So I suppose we go to this, how do we do it? How do we extract and scoping reviews? And these are some principles that help guide us. So for me, I only want to extract what is relevant. In scoping reviews, we extract a lot of high-level data, but sometimes a little bit more detailed information as well. And so, or more detailed than you would in a mapping or an evidence and gap map. So only extract what is relevant. I have been on teams, especially in my early days, where everyone would be like, we've got to extract this and this and this and this and this. But you need to go back to, what are my objectives? What am I actually trying to answer here? And will me extracting those items actually help me answer that question? And if it's not, then don't extract it. There is absolutely no need to. So only extract what is actually relevant to the research question. Utilizing extraction tools and forms that are very specific to your scoping review will save endless amounts of having to check and recheck and recheck. You are working in teams here. So this again helps you with those clarifications that will always come up when you're doing any type of evidence synthesis. With that, pilot. You need to pilot your extraction form to ensure that all relevant results are extracted. And even when you're in your piloting, I ask people who are doing the piloting, how long did it take you to extract this article? Do you think we are missing anything that should be included on the extraction form? Do we have too much to extract, like to the point that you don't think it's actually relevant? How can we make this extraction form better? So if you're asking your extractors to reflect on the extraction form, I find that can truly help the process as well. Now, in saying this is also an iterative process, especially if you are, I suppose, trying to work out what is the available evidence out there. Sometimes you might get through quite a few extractions and go, oh, we need to actually extract something else. If you have that little inkling, that constant and open communication needs to happen. So straight away say, do we need to add this to the extraction sheet? Have your discussion, because you don't want to finish and go, oh, we should have extracted this, and then have to go over every single one of those and extract it. So try to be as prepared as possible. And with that, it's so important to keep careful records. You're going to sometimes have an article that you go in the full text review, get to the extraction, you go, oh, that's not actually included anymore. So you need to actually keep that detailed documentation as well. So with this, I get asked the question, how many people should extract? And again, when I was a young, naive evidence synthesizer, I would say one person, it's fine. Now that I've done this so many times, I see so many errors, even from a seasoned professional. I would say at least two. If you can't have one person, but you definitely have someone checking, because the risk of errors, or unfortunately just not reading something correctly, or just, human error, and we're prone to it, especially when we're doing this type of data entry, essentially, can really be impactful for your work. So I really strongly recommend, if you can have two reviewers to then go to consensus, I highly recommend. If you can't, have one reviewer, but then have a checking, and also discuss that within the limitations of your project. So when it comes to extraction, to help with that clarity, having these extraction information sheets are fantastic. especially if when we go, you got to think to analysis here, when you've got this massive data set, you want everything to be done the same way, right? Because when you're, say, doing your analysis in Excel, if you have systematic review written in 3 different ways, and it can be, you can have capitals here, capitals not there, you've got to have to do some extra processes to clean up that data. So you want as clean a data set as you can. So write to the very specific degree of exactly what you want here, and be as explicit as possible. Have meetings, talk to people, pilot people's work extensively, and make sure that you can really get them to understand exactly what you mean by that item that you are extracting. So in scoping reviews, where do you extract from? In systematic reviews, that's an easy question. It's the results. You are extracting the results. The results are what are, have that finding that you can insert within the meta-analysis. So that's easy. But for a scoping review, anywhere at all in that article is relevant. So you're not just extracting results here and a few basic key descriptive details of the methods. You can extract the title, the keywords, the abstract, the introduction, the discussion, the limitations, anywhere that is relevant to answer your research questions. But often it's not the results section. If you are seeing the results section, and what I mean by that is the actual specific results of effect, if you want the effect of the results, you need to do a systematic review. That's a question that can easily be turned into a systematic review question. So we're often not extracting the results section. We might just extract what are the outcomes, what are the tools to measure those outcomes, but not necessarily the results section. And if we are then not creating these findings that are to be interpreted through a meta-analysis or through a thematic synthesis. So really reflect. If you need to answer your question, and the only way you can answer your question is through a higher order of analysis, like meta-analysis, then you need to change to a systematic review question. So this is just an example here, and the highlighted bits is maybe what I could extract from this article. So I would extract maybe that it was a survey design, that snowball recruitment was used. I might extract, as you can see here, the scales that were used, because that might help me understand future systematic reviews to go, okay, we can bring all this information together. I might extract exactly what was the methods that was utilized to analyze this data. I probably may read the results just out of interest, but sometimes I would ignore those results if that's not what actually I'm looking at here as well. There's one scoping review I'm a part of where we're looking at the barriers and enablers methodology. So we're not even looking at the results, we're looking at the how they did the methods of this particular paper. So what software can be used? So this was something that was done in Excel, and I'm so sorry, it's tiny writing, but I wanted to, and this is only a quarter of the size of this extraction sheet. There are many benefits to using a program like Excel. It's free. And you can do your analysis in there. You can also be able to create graphs and presentations in there. So for many people, Excel works perfectly fine. However, there's some issues, a lot of version control issues. You generally have to allocate the studies themselves. So you have to be sure that that person is actually going to do their allocated extraction. And you'll often find people, again, if you're not creating these drop downs, and you can within each cell of Excel, inconsistent ways that people are extracting and not having confined responses. And that can help and really mess up a bit of your analysis as well. So Excel's fantastic, and I've used Excel in this. Hopefully we will be able to do this. Now, I've just been told my camera, I might be stalling a little bit in my internet, so I might just turn my camera off, and hopefully that is okay. So the next stage that we go to is, or the next software that I've used is Covidence. And Covidence have created this extraction information template where you can create this from scratch. So it's brilliant, and you don't require any coding. And I generally love Covidence in what they do for their extractions here, in the fact that it's really, I think, helps scoping reviewers be able to extract in Covidence. The reason I like it is that you can set preset responses. So this is for the scoping review that we've recently done, which has over 400. So this has allowed us to really set these pre-responses so that when we go and analyze, we know that, say, clinical sciences is going to be presented in the same way. And so that cleanup of the data is a lot less and we can control the responses that receive more. That doesn't mean that we don't have things like other, where people can write those responses in there, but honestly, it does help to have consistency and clarity in how you want everything written. We also have a table within this, and this is a little bit more difficult when it comes to consensus. So I suppose this is my con, in that if you want to list these rows, when it comes and you say, I did methodological systematic reviews, and someone as the first row, and then someone does literature reviews as the first row, then that creates a conflict in Covidence. And it's not like I can easily move those rows around like I would do in Excel when I'm checking to ensure that we're getting all the information correct. So that, I suppose, can be a bit of a tedious issue if you are utilizing tables like this in Covidence. However, if you're not using a table and you are just using these higher level responses here, or pre-coded questions, then I think Covidence is fantastic because you'll get the article there, and then you can do it side by side. So this is kind of what it looks like when you are doing your conflicts. And so just to recognize that it can be quite easy, you pretty much just check which one is actually correct, and you go from there. So then you end up with this data sheet. And again, this one has over 400 scoping review, articles included in this scoping review. So you can see that it's quite a mammoth task and to check. And I just want to emphasize the fact that this takes time. Be kind to yourself. This takes time to clean up this data and to really understand it. So once we go from extraction, we then also go into data analysis. So what kind of data analysis do we do in scoping reviews? Well, we tend to do descriptive statistics. So this is a lot of frequency counts, very, very basic data. As I said, scoping reviews do not address questions of feasibility, appropriateness, meaningfulness, and effectiveness, and as such will not and should not apply advanced analysis methods. So if a scoping review authors feel that they are unable to answer their questions without the use of a meta-analysis, then you need to look at a systematic review approach. So it means that when you are extracting that relevant information that aligns to the coded yes, no, unsure responses, for example, all of that can turn into a descriptive number where you can say this amount of percentage did this way, and that can help give you the information that you need. However, if you've got more qualitative, basic qualitative content analysis, can be undertaken. And this allows us to be able to say, okay, so what were the barriers and what were the enablers that were identified within this article? And then you can basically go, this extracted information was a barrier, this extracted information was an enabler. But that is very basic qualitative content analysis. So that, I'm sure we're all seeing this, but this is what the descriptive and the frequencies would look like here. Very much about just how many and the percentage. So what about qualitative data? And just emphasizing here, do not do more than you need to do. It may be tempting, and I am tempted to always do this, to choose a very in-depth qualitative methodology. So something like thematic analysis or thematic synthesis, meta-aggregative approach or meta-ethnographic approach, that is again beyond the scope of a scoping review, and it would more appropriately fit within the objectives of a systematic review. So the best approach would be akin to a very descriptive qualitative content analysis, which includes a very basic coding of the data. So this may result in scoping review results providing a summary of the data coded to a particular category. So again, you probably would change a lot of this back into these quantitative descriptive numbers to explain what you're trying to say. So people use basic qualitative content analysis and in software such as In Vivo. You could potentially do it in JBI Summary. Some people do it in good old pen and paper. You know, there's many different ways that you can actually do this basic qualitative content analysis. So this type of approach does not need to be undertaken at all if you don't need to undertake it. But if you're, say, trying to explore characteristics, or if you're trying to explore barriers and facilitators, then you're probably going to use some element of a basic qualitative content analysis approach here. So this is what we suggest you can do. The first step before any of these approaches is an immersion in the data. So an initial read of all your evidence sources and then reread them again, probably reread them again. I tend to start taking notes as I kind of understand it a bit more. And then we have to go, are we doing an inductive? So this is where we have to develop a theory or a framework during the analysis and the extraction process, or do we already have this framework in place? So it's already a framework that has been utilized. So the theoretical domains framework, and where exactly when we're extracting, we're actually extracting straight into that framework as well. So that's why you see this extraction and analysis come together, the process, so to speak. So a deductive analysis is you've already got it, you're going to then extract according to that framework, and then you're going to review it and say, actually, did that describe everything that I needed it to describe? And an inductive extraction analysis is where you actually are developing the framework. So that requires open coding. So that requires you to read the evidence sources, writing your initial thoughts, those categories or notes that describe the data, and that will help develop that coding framework. You're then going to develop your coding framework. And then after you've developed it, you're going to then extract exactly like you would have in a deductive. You've got that framework now developed, you're now going to extract into it. And then once you've reviewed it, you potentially could go further with it and categorize the information to that next step. But I just want to say that this is a very low level of interpretation, and we're not expecting very high in-depth interpretation within this approach as well. It is very much about an organization system of the data to kind of explain it. So this is a case study, and this was a scoping review I worked with on patient journey mapping research in healthcare. And again, there's a QR code if you'd like to read it. It's a very good example, not just saying that because I'm an author on it. But this was the deductive approach that I talked about. Basically, the framework was already in place and we extracted to it. And the framework was actually reporting guidance, because we wanted to know how these articles were reported. And as you can see, there was a set of questions and the responses were basically asterisks and NAs, and the asterisks indicated if they were there, if the presence was there or not. Also, were these articles actually reporting according to the guidance? So that was our predefined framework, so to speak. And then that ended up as the results as, again, very descriptive information here. So the next question we had was, why were patient journey mapping studies undertaken? And this allowed us to go, well, we need to do some sort of characterization here about why. And so we had to go to this process of this inductive analysis. So again, immersion, we then tried to develop the framework with this open coding. We then developed the framework and then we extracted and categorized. So what did that actually look like? A lot of teamwork, a lot of us being together in the same room, reading the data. So we had an initial extraction item was basically verbatim responses, what we found about why that methodology was done. So we had that already there as a basic extraction item, but we're then wanting to categorize that further. And so what we did was we looked at the extracted data. Communicative approaches in describing patients' journeys can shed light on the opportunities and challenges to enhance care for better outcomes. So that was the extracted data that we had previously looked at on the response, why? Why would you do patient journey mapping? Then our initial thoughts on open coding kind of came into play. And we thought, well, whether it was about informing, it was about opportunities and challenges that can lead to improvements. It could be better patient outcomes. And so we led to that being a category development of informed health service redesign and improvement. And so we're not, that extracted data is not just coming from one article, you'll have all of that extracted for those articles that produce why. So it then led to quite a lot of good visualization, and I'll show you this pie chart about all the reasons that we categorized. Again, we then turned this in to a very descriptive approach. We had the categorization, and then we had the number of articles that went into each of those categories, and then we also had like an example of the extracted data to explain it and to show transparency. So the next step, I suppose, is visualization. And I'm very passionate about visualization because scoping reviews can truly be death by table. Tables are great and we need to include tables, but what do they truly do for someone reading your article and trying to bring all this information together on this vast amount of evidence sources? So you need to actually visualize your data in a way that your reader can help understand what you are saying, not just go refer to the table. So pie charts, for example, are great. This was in the patient journey mapping where my very talented colleague basically worked out each of the different ways you can map someone's journey and then developed these to be able to go, well, which way you're actually mapping it and a visual of that. So that becomes a very useful tool to anyone that is now going to undertake patient journey mapping. You can use world charts to be able to work out how many articles come from where. You can use people, figure charts, bubble charts, tree maps, anything you want to do to present your data. The world is your oyster. Please do more than a table, though, is my passionate plea to you all. And then something I think you've probably seen some of these if you follow me, but I love the idea of broader dissemination. When you finish your scoping review, that is not the end. I always see us as researchers and evidence synthesizers as advocates. And a lot of that work that I do is hoping to improve the work that others can do in this field and to help just someone else a little bit. So even though I do a lot of methodology work, I feel like I need to do infographics to help and explain that, to break it down. So, and to basically send my findings out there to be utilized, because that's what I want it to be done. I don't want it to be just a paper. I want it to be utilized. And what I find is infographics really, truly help. Or something like plain language summaries, break it down. What exactly do you mean? Yes, we're all methodologists, but that doesn't mean that, evidence synthesizers, but that doesn't mean that we shouldn't be breaking this down to very specific steps. That's why I like social media. my favorite is Twitter, although I think I've done some things on Instagram with JBI. Haven't yet gone into TikTok yet. I can't dance. But these are just some infographics I've developed. This was a decision tree for selecting scoping review methodology. This was infographic on the differences of big picture reviews. And this was a breakdown of how to actually include knowledge users in JBI guidance for scoping reviews. But these are all been on Twitter. They can be shared, they can be downloaded. And I'm hoping that someone can be able to look at that and go, oh, I can understand what I can do. And they get more shared than the article themselves. So it's a good approach to do. And I also just want to shout out about the Prisma scoping review. So yes, you have your conduct guidance. So that's your recipe on how to do the actual scoping review. But we also have reporting guidance, and that's our Prisma extension for scoping reviews. And this really will help you make sure that you're reporting your scoping review to a very transparent and rigorous manner. So make sure that you are not just having reporting your conduct guidance, but also using reporting guidance as well. And my final slide is to join the Scoping Review Network. And this is anyone who's absolutely interested in scoping reviews. And these can be from first-time authors to experienced methodologists. We love to do a lot of newsletters, and we're trying to bring more events in. And, you know, please send me emails if you need. So hopefully if you are in a tricky spot, I can help in any way and really break down that process for you further. Okay, so that's me done. Thank you for listening. I'll hopefully be able to turn my video back on, and my internet hopefully will continue to work.